Breast cancer is the most common cancer among women, though it can occur in anyone that has breast tissues. About 1 in every 8 women are diagnosed of breast cancer in their lifetime. Conversely, about 1 in every 1,000 men are diagnosed of invasive breast cancer. Breast cancer starts with a tumor. A tumor is a mass of abnormal cells that rapidly divides and grows. Most tumor begins in the lobules, that is, the gland that produces breast milk, or in the duct, that is the duct that transports breast milk to the nipple, or in the connective tissues, that is the tissue surrounding the lobules and the duct. So on today's edition of Know Your Health, I will reveal what breast cancer is, the myths about breast cancer, and the 10 important risk factors to developing breast cancer. In my subsequent presentations, I will be revealing the signs and symptoms of breast cancer, the diagnosis, the treatment, and the prevention to developing breast cancer. If this is your first time or coming across my channel and this is a content that you are interested in, please do well to subscribe, put your notification bell so that you don't miss out. As a returning viewer, I want to say thank you for finding my video worthy to watch and sharing. Then what is breast cancer? The breast cancer is a disease that starts in the breast with a malignant tumor. A malignant tumor is a mass of abnormal cells that grows out of control. The cancerous cells can metastasize or move to other tissues or other parts of the body. Breast cancer can develop in any of the 3 breast tissues, such as the lobules, the duct, and the connective tissues. Most breast cancer begins in the lobules, that is, the gland that produces breast milk, or in the duct, that is the tube that transports breast milk to the nipple, or in the fibrous and fatty connective tissues, that is the tissue surrounding the lobules and the duct. Several types of breast cancer exist. The type of breast cancer, each stage, or the extent it has gone determines its treatment protocols. However, some breast cancer can metastasize or move to other tissues or other parts of the body, known as invasive breast cancer, while others can remain in the tissues such as the lobules and the ducts, known as non-invasive breast cancer. Myths about breast cancer. People have asked so many questions about breast cancer, like, can men develop breast cancer? Yes, the possibility of men developing breast cancer is there because men has breast tissues, though it's not common when compared to women. About 1 in 1,000 men can develop invasive breast cancer, as opposed to women, where about 1 in every 8 women can develop breast cancer. So the possibility is there for a man to develop breast cancer. The second myth about breast cancer that people normally ask is, what does breast cancer looks like? Often there is no external signs of breast cancer, but some visual signs that may include changes in the look, feel, or nipple discharge can be observed from someone suffering from breast cancer. But if you are just seeing this, you still need a further medical examination from your doctor to confirm whether you have breast cancer. The third myth about breast cancer that people normally ask is, does breast cancer hurt? A lump in the breast is the most common symptom of breast cancer and is usually painless. 10 risk factors for developing breast cancer. The largest risk factor for developing a breast cancer is simply just being a woman. An estimated 12% of women who may have average risk of breast cancer will develop breast cancer at some point in their lifetime. A variety of factors can increase the risk of developing breast cancer. Number 1, age. The risk of developing breast cancer increases as women ages, particularly after the age of 50, between the age of 60 and 69. Approximately 2/3 of all invasive breast cancer occurs in women at least at age of 55. Half of all cases are diagnosed at age of 62. So age is an important risk factor for developing breast cancer. Number 2, family and personal history. The risk of developing breast cancer increases if you have a relative with breast cancer diagnosis. Your risk is twice as high if your mother or your brother or your sister or daughter has been diagnosed with breast cancer. If you have a personal history of breast cancer, your risk is 3 to 4 times greater aside from any risk of the previous cancer returning. Number 3, genetics. Women also have substantially increased risk of developing breast cancer if they carry mutation in one of the 2 genes known as BRCA, which are known to be linked to breast and ovarian cancer. Though there are other gene mutations that could increase the risk of developing breast cancer, but they have significantly less risk when compared to the BRCA mutations. Number 4, history of radiation. If you have ever used radiation in treatment of any cancer aside breast cancer, or when you were in adolescence, you used radiation in treatment of acne, this can increase your lifetime risk of developing breast cancer. Number 5, history of Dietist Testerone use. Dietist Testerone is a drug that was prescribed between 1938 and 1971 to sustain pregnancy in pregnant women. Dietist Testerone is a non-steroidal synthetic estrogen that is normally prescribed to pregnant women to prevent potential miscarriage by stimulating the synthesis of estrogen and progesterone in the placenta. So if you are taking this drug, you are exposing yourself to high risk of developing breast cancer. Number 6, increased weight. Women have a high risk of developing breast cancer if they are overweight or obese, particularly after menopause. And the chances of reoccurrence are also high in overweight women. So you should just try and cut back on calories and involve yourself in daily exercise to ensure that you have a healthy weight. Number 7, pregnancy and breastfeeding. Women also have slightly increased risk of developing breast cancer if they do not have a full-term pregnancy before the age of 30. However, breastfeeding confers some protection to the breast, thereby reducing the risk of developing breast cancer, especially when it is done up to a year or more. Number 8, menstrual history. Women are at a higher risk of developing breast cancer later in life if they got their first period before the age of 12 or did not enter menopause after the age of 55. So this is another important risk factor for developing breast cancer in women. Number 9, use of hormone replacement therapy. Hormone replacement therapy is a medication that contains the female hormone known as estrogen. You know, at menopause, the estrogen stops producing. You are bound to experience menopausal symptoms such as hot flashes, vaginal discomfort, especially during intercourse. So this hormone replacement therapy is used to treat these menopausal symptoms. But studies have shown that this hormone replacement therapy increases the risk of developing breast cancer in women. So you talk to your doctor so that I can recommend other safer medications you can use to avoid developing breast cancer. Number 10, race and ethnicity. White women have slightly higher risk of developing breast cancer, followed closely by black women, compared with Latin America, Alaska, and Asians. Among women under 45 years of age, black women have higher risk of breast cancer and tend to develop more aggressive advanced breast cancer than others diagnosed under the age of 50. Black women are more likely to die from breast cancer than other race or ethnicities due to unequal access to healthcare.